These are the state of healthcare in some specific area of Anambra State. Today we are here in Okas North local government area in a specific region called Mbaku. This is the primary health center located here at Mbaku. Getting to the PSC, we were caught with a good, clean, well-ventilated, conducive environment with trees like the cashew nuts and avocados. We started by going to see the health officer in charge of the facility before proceeding to interview the workers. During the interview, the first nurse identified her name as Adibe Happiness, has worked for a long period of 3 years as a volunteer health worker, meaning that she was not officially employed into the Anambra State Health Center. Rather, the facility employed her with its money to assess the health center. Speaking at the interview with Mrs. Happiness, she stated that they faced numerous challenges, such as lack of good treated, long-lasting insecticide nets, and it affects the workers and patients as well. She emphasized on the urgent need for long-lasting insecticide nets for pregnant women to screen the rate of maternal and child health mortality rate.
We have many challenges, but I will talk about the one of not having net. You know, in this our environment, malaria is too much, so we need net, insecticide net that will be given to pregnant mothers because they do demand for it every time, even for people that do come for immunization. So we need insecticide net to give to them. So that is it.
Okay, the vaccine for immunization, how do you people often get the vaccine for immunization?
We get the vaccine for immunization through the CCO. They do get it from the states. So we do get it from the states through the CCOs.
Okay, so if I may ask, what are the needs? What do you want the government to do for you? What are the needs you want the government to, at least, even the NGOs to assist?
Okay, I want them to provide long-lasting insecticide nets that will be distributing to people, especially pregnant mothers, so that the babies in their womb will not be affected by malaria.
The second person who identified herself as Ezibile Amarachi, who was also present during the interview, cried out bitterly on the state of healthcare of the workers in Mbako, stating that mosquito, which is the causative agent of malaria, is everywhere in the facility, which has contributed to the poor health state of the workers, adding that there has been recurrent malaria among the staffs and people living here in Mbako. Mrs. Amarachi also said there is no sufficient drugs for malaria and typhoid treatment, including antibiotics for serious infections.
We are facing a lot of challenges, but the main one is that this facility, like, mosquito is too much. Like, I'm ill now. The mosquito hit me last week when I was at night duty. So that was the reason I'm taking these injections now. The thing is that, and again, we don't have fan. This one now don't used to work. The other one, in fact, all those wards, we don't have fan there at all. Like these ones now that they do for us, it was last year they did it. And that was when we were complaining to everybody that came. So that was when the government helped us with these ones. So the one we are facing now is fan. We don't have fan. The scientific nets, no nets, nothing, especially for the pregnant mothers, like this, because that is the challenges we are facing for the now. And we don't have pits. We don't have pits for the placentas. It's filled up, the one we have, even the disposable, the ones we used to dispose something, it's filled up. So that is the challenges we are facing for the now. Yeah.
Okay, I've heard what he said. So, based on these challenges and what do you have to tell the government or NGOs or individuals that are capable? What do you want them to do now concerning these challenges?
Okay. Like the challenging the ones of that net and the fan, please they should help us. At least if it is only the fan to be okay. Like if we have patients at the ward, we don't have any fan. Like there's no fan to, they will be conducive there. To be heat very very, and they are complaining. Even in fact, we have fan. Fan is the most one now. Please they should help us.
During this visit, we saw the laboratory office and there were no good testing equipment, which she also cried out bitterly that equipment are needed for testing of illnesses. The third staff which were interviewed was Mrs. Anyobi Agnes, who is also a worker and have worked for a period of 5 years, noted that they need workers, capable and competent workers, as there are many works to do without workers. Mrs. Anyobi Agnes also said that there is no drug for treatment of illnesses, and she pleaded with the government to distribute the necessary drugs for curative purposes.
You know, malaria is common in Nigeria. So frequently we treat typhoid and malaria, even vomiting and stooling. That is the treatment. Well, as a government, we need some drugs for them now, like typhoid and malaria drugs. Sometimes they are not bringing drugs for treatment. We buy drugs at market. So we need government to supply us some drugs for typhoid and malaria and vomiting and stoolings. That is it. Then we need some chairs here. Some patients will come, they will not see to sit down. Yes, that is the challenges. These are our surrenders. They have done some certain places. Then we still need other remaining sides to be tied. Yes, that is our challenges. Thank you.
According to the nurses, their placenta pit has filled up and they need another pit where they can bury placentas after childbirth. We also interviewed the officer in charge who identified herself as Mrs. Nduka Virginia. She cried out bitterly that they needed an ambulance for emergency referral purposes. She also added that they need some facilities and dormitories for staffs to reside. She also said that more drugs are needed, for the rate of drugs are very high, so government should come to their aid in the production of drugs for patients to get well. She also said that due to free immunization and antenatal care given to patients, that they no longer earn money to get the necessary drugs needed for other patients to be treated. She also mentioned that they lack network, that it affects them so badly. I'm here with...
Hello.
Good morning, ma.
Good morning, my dear.
Please, your name?
My name is Miss Ndoka Virginia.
Okay, Mrs. Virginia, how are you doing?
Fine morning.
Okay, I heard you're the general manager of this clinic.
Yes, of course, I'm the one. By special grace, not by my power, but the special grace of God.
Of course. Everything is by His grace.
Yes, of course.
Wow, congrats for such position.
Thank you, thank you, thank you.
Okay, ma, please, for how long have you been working here?
I'm short. 3 years and now, Sha. 3 years and...
Wow.
Yes.
That's very great. We can even see some of your award over here.
Thank God.
Wow. Congratulations.
Thank you, my dear.
Thank you, ma. Since you've been working here for now, what are the challenges you've been facing? What are the challenges here in the hospital?
Okay, thank you very much. In short, we have many challenges. Like, for example, we don't have staffs. The volunteers, I'm the one who paying them. So at least if the government employ them, at least the work overload will reduce, understand? Because you know that this, our government now, we have free delivery and free antenatal, understand? So free immunization. So those things we used to eat money, you are doing it free. Understand? So I don't have staffs. Then secondly, we don't have ambulance in case of emergency. Yes, of course. We need I need ambulance. Honestly speaking, I need ambulance because day before yesterday we have a woman. She's in labor, but at the point she didn't deliver the baby. Then we need ambulance. We need to rush her. So, but we didn't have it. At least I told my staff to go outside and look for keke. So for really keke, before you see keke, more than 30 minutes or more than that, understand? So it is our problem, our challenge. Then another one is we didn't have, honestly speaking, network. It is a barrier, understand? So it disturbs us. Then another one is drugs, equipment, drugs. Because if you go to market and buy drugs, in short, as of now, 18 of paracetamol is 10,000 plus. If you go to my head bridge, you know that since 2 months and none, they closed head bridge. So you go to Relief Market or Asaba, or you go to pharmacy to buy drugs, which is as costly as. So we need help on that side. We need help. So and our placenta pit is already full. Then we don't have burning pit. So those things, it is our challenges. So we need them. Thank you very much.
Okay, so these are the things you want the government to come to.
Yes, government or an NGO to come and help us or assist. Yes.
Thank you, ma. We appreciate your time. Thank you very much. Coming to the maternal ward, she also mentioned that there are no delivery equipment, baby bed, circumcision equipment, and more. She also cried that they needed more in and out patient ward. With this help, definitely she believed that the primary health center will be a perfect place for treatment.
So inside here now there is no fan.
It's not well like that. It's not what, there's no light. So this light is not enough.
So this is the labor ward.
This is the
Bed.
living bed. This is the living bed. This is the baby's bed.
Hey, baby no go fall like this.
So they really need a capable bed for little baby.
Yeah.
They really need, because baby might even fall down from here.
I'm telling you.
Tablets, injections too. Okay. So definitely you people will be needing more of this. People will be needing more of this. There is no problem. So these are the kind of drugs and injections they have here at Mbako Health Center.
Meanwhile, one hospital in one big place, they're not even doing as much as this. Wow.
That's very nice.
I love the fact that this place is
What are the kind of the vaccine you often have the vaccine here? Okay.
that is after drawing this should please do it.
Yeah, she can do it.
Dispensing unit, right?
Yes.
Drug unit.
You can